I had a conversation with a woman who spent $25,000 on blood tests for her daughter to figure out what was going on with her health. They did find something, and she's been on a program for mold now, and she's about 70% better, which is great. But this can be easily done at a much lower price by using MVX Plus. This lab test is the pinnacle at the top of your decision tree as to what to do with your health. In the medical field, there's a ton of labs that measure all the symptoms, all the organs, and they measure pathology and risk factors and dysfunction. But we have MVX Plus, which measures physiology. Now, there's a lot of physiology you can measure, but this measures the 6 most important factors, and they come down to 5 different subjects. Those subjects are malnutrition, infection, inflammation, toxicity. Those all lead to mitochondrial dysfunction. These are all measured with one simple blood test, and the price is very, very low. At our office, we charge $89 for it. And this is the decision tree right here. So you run MVX Plus, and there are several subjects that come up, and they have to do with below me glycate, small shell particle number, citrate, and branched chain amino acids. I don't want to get too technical with this one, but glycate, there are 2 factors. One is infection, the other one's inflammation. And then small shell particles are toxicity. These subjects I just mentioned, that's kind of a big deal. It can take months, even up to a year, to get cleaned out of all the toxins and to help your immune system get rid of all the organisms. So it's a big deal if these things are off. Next, we have the malnutrition factors. We got citrate and branched chain amino acids. These can actually get fixed up within, 4 to 6 months, let's say. So these 2 are easier to take care of. These 2 take a little bit more time. And these are more important than testing and treating for symptoms. Let me show you what that means. Testing and treating for symptoms occurs right here, and this is the red circle. And the way that you get rid of symptoms in the holistic viewpoint is to feed the organs. Really good food and really good supplements designed to feed the organs, and people feel better. In the allopathic medical world, they treat the organs with poisons to try to shut it down, to try to stop any symptoms. So either way, addressing symptoms isn't really a valid therapy unless you also fix the mechanisms here. There's really one. And then you fix the causes here. And there are 3 major ones. And they are toxins, pathogens, and excess sugar or not enough protein in the diet. Well, this test, MVX Plus, measures these 3 factors right here. The small shell particles are toxicity. Glycate is the pathogens and inflammation. And the branched chain amino acids are measuring the diet. And if you go over here, citrate measures the mechanism called lactic acidosis. That was what they called it back in the 1930s. It's still a legitimate concern. And concurrently with that is a thing called mitochondrial dysfunction. These 2 pathological states occur at the same time. They are concurrent. Mitochondrial dysfunction occurs within the mitochondria, and lactic acidosis occurs outside of the mitochondria. And all of this occurs in the cells. So we're really trying to fix up the cells and the function of the cells right here. But why does all this matter in the presence of your symptom or your concern? Let's say you have hyper or hypothyroidism. Why is that? Do you have toxicity or malnutrition or infection or inflammation causing this to occur with your thyroid? You can have nutritional deficiency. That's a problem. And that's part of the red circle, feeding the organ. So it's still legitimate to take iodine or to take some dried bovine, like desiccated thyroid. But you still have to get rid of the toxins and the organisms that might be causing problems with the thyroid. And let's say you have a little bit of jaundice and something's going on with your liver. Same thing. What's in your liver that needs to come out? Do you have toxins? Did you have food poisoning a few months ago or years ago that caused this? So you got an organism in your liver? Do you have inflammation or malnutrition causing dysfunction of the liver? This is true for every single organ. Is your brain not as happy? Do you have short-term memory problems? Do you feel brain fog? What are the organisms, inflammation, toxins that need to come out of your body? When I got sick with black mold in 2016, there was a realization at one point when I realized that there was something in my chest that needed to come out. I didn't know it was black mold, but I was laying on the couch, I was laying on my stomach, and I kind of just stretched out like this, and my sternum goes pop, 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 pop. And I was like, wait a minute, that's never happened in my whole life. What is in my chest causing that symptom? Plus, I had trouble breathing and had heart pain, left arm pain. So this is what's missing in most of medicine. I'm going to say all of allopathic drug-based medicine and a lot of even the holistic doctors. They're missing toxins and organisms that need to come out. So the basis of your health improvement is to remove the bad stuff out of your body. Now, we've been trained for decades to take more powders and more pills and look for the next miracle pill. And there's magnesium and there's, all kinds of supplements. And I'm a fan of all of them. But what do you need? Probably need a detox first. And that could be chemicals, metals, even radioactive elements. There's tests for that. And it could be getting rid of organisms, could be parasites, Lyme organisms that are inside the cells, candida, mold, fungus, virus, chronic bacteria. And medicine's not very good at chronic organisms. They're really good at acute infections. Like if you have a bad bacterial infection and you're coughing up some green stuff, you need some antibiotics. And it could all go away in 14 days. But what about if that happens again and again and again? In the course of 3 months, it's happened 4 times. And then 1 year, it's happened 6 or 10 times. There's something going on in your body that needs to get repaired. And you got to think first, what's toxic that needs to come out? Maybe you have too much inflammation associated with fibrin, and that causes your blood to be thick, too much mucus, too much biofilm, and you have to lower that down. So that's why MVX Plus is the top of the decision tree, because it measures the things that are the soil upon which chronic disease and mortality grows. And when you order a bunch of lab tests, whether it's holistic, functional medical stuff, or regular straight up standard hospital medical labs, it can scatter the data. So I've been through this my whole career. I'm reading a whole bunch of labs, and it doesn't really tell a cause. It doesn't really point you in the right direction, because somebody can have a bad thyroid and their liver's off and their lipids are high and they're fatigued. Some people have normal standard medical tests and they have terrible health, terrible fatigue, chronic pain, muscular pain, brain fog, and their labs are totally normal. It's because the labs are not measuring what's really important, and that is physiological functioning. So we're measuring physiology with MVX Plus as opposed to measuring risk factors or pathology. And the whole point is to get those physiological functions back up to functioning very well, and then symptoms go away. So the first step is to check MVX Plus. Now, some people have had really good scores on their MVX. There's 9 things that are listed on the MVX Plus. And I've seen these numbers. It's like, well, it doesn't explain how sick you really are. So then I know that MVX Plus is missing something. That's happened twice now. And there are people who I've been told have really good scores with MVX Plus, and it doesn't make sense as to why they're feeling so bad. But then you look at their scores, and I can see, even though they have overall really good scores, in relationship to each other, I can see that they have some problems going on inside their body, because the scores relative to each other can still be off. It's just a matter of knowing how to read MVX correctly. I had a person submit their MVX results, and their score was in the top 10 of probably 900 now, but I could see that he eats too much sugar and he gets infections. Even though his scores overall were really good, I could just see the ratios were off. Now, you may have been through a lot of holistic care, detox, or you got rid of some parasites, and that's great. Run MVX Plus and it'll tell you where to go next. I've had people do this where they got rid of organisms and parasites and they felt a lot better, but then MVX tells them that they're malnourished or they need to get rid of some heavy metals or chemicals. So MVX Plus is at the top of your decision tree, and you can redo MVX multiple times throughout the year to see where you're at, to look for improvement, and to see where to pivot to. And sometimes when people are detoxing, MVX can look worse, which is totally fine, because they're feeling better and they can see that their body's actually going through the detox process. So MVX Plus is the best test in all of healthcare, and it gives you that 30,000-foot viewpoint as to where to go with your health. It doesn't measure everything, and keep in mind it's a blood test. You can still have some nutritional deficiency in an organ, and when you do this blood test, you're not measuring actually the organ itself. So there are some limitations to it, but I still stand with the statement that it's the most important test of all the tests. And then based on it, you can do some parasite testing with stool analysis, heavy metals with urine analysis. You can do standard blood tests for thyroid function, et cetera, et cetera. If you want to get MVX Plus run on yourself out of my office, it's only $89. Go to the front page of my website, upper right corner, click on MVX testing. We'll put you through the process. If you're a doctor, you want to learn how to read MVX and use it clinically, go to mvxtraining.com. If you're not a patient in my office, you want to get your feet wet a little bit, click on this B1 ebook. Vitamin B1 directly affects 4 of the 6 factors of MVX. That's how important vitamin B1. In 2024, I said that vitamin B1 is the most important nutrient for humans and plants and animals. It is endemically deficient. So if you just want to get your feet wet, get this ebook on vitamin B1. And I just launched theholistichealthacademy.com. This is a community website for people who want to learn the 7-step blueprint to optimal health and understand diet and supplements. And you can pick the diet that you want. There's 1,800 recipes based on the diet that you need: carnivore, keto, Whole30. And we're going to have some online courses at the same time that will go live. So that just launched recently. So I have a lot of resources for you to jump into, whether you want to become a patient or just get some online training or just read an ebook. If you're a doctor, go to mvxtraining.com. There's a lot of resources for everybody to get your health better.